Before we begin, I'd like to emphasize that this podcast is an extension of my surgical work and research at Visionary Eye Doctors. And thank you all for tuning in every week or multiple times to kind of hear about our research and how we help patients. And thank you to all of you who have flown in from all over the world to see us here. So I'm very humbled by that. So it is my hope and desire to keep this information free to all of you, especially to my dear patients. And in keeping with this mission, we are very thankful to our first sponsor for this podcast, Wizard Dry Eye Mask. Many of you have heard me talk about the Wizard before. I have loved this product for years. It looks like this. I have one right next to my bed. So does my husband. I used mine last night. And even, if I can't sleep, I'll use it. It's a wonderful product that you just plug in next to your bed or even at your computer. I've been known, if I start to develop a stye, to do the Wizard as I type and then switch, if I have warm, just like a warm compress. So it works wonderful for that. So thank you to the Wizard. If you mention our name, podcast, Visionary Eye Doctors, Dr. Cremers, they'll give you a 1-year guarantee. If anything happens to the product, just call them up and they'll replace it for you for free. So thank you to the Wizard Research team for sponsoring this podcast. Enjoy. Hi, everybody. Thank you for joining us for the EYE Show podcast. I'm Dr. Sandy Cremers, one of the board-certified surgeons here at Visionary Eye Doctors. Today, we're going to talk about one of the most common questions I get in my office with patients that have dry eye symptoms, like burning, tearing, reflex tearing, pain, foreign body sensation, grittiness, and even blurry vision or decrease in vision. And the question is, should I take testosterone? Should I take, if you're a woman, bioidentical hormones or hormone replacement therapy? This is a super important topic, one that we could spend 3 sessions on. So we're going to start with the first session to kind of answer the question, are these hormones important and should you take them? And so the answer is yes. These hormones play a crucial part in making the tear film complex work properly. As everyone, men and women have testosterone, estrogen, and progesterone. And as we age, that tends to decrease. If you're a woman who's pregnant or having their menses, we know the estrogen and progesterone do increase and decrease on your pregnancy, during your menses, and as you enter perimenopause, menopause, and the postmenopausal time, that affects the function of your cells. So the cells that are crucial for the tear film, as we've talked about before, are the meibomian glands that produce the oil at the base of the eyelashes. Those produce oil. The water comes from the lacrimal gland underneath the top bone, the temporal bone of your orbit. That's called the lacrimal gland. It produces water. And the mucin, which is the molecule that mixes the oil and water together on the surface of the conjunctiva called the goblet cell, produces this mucin. And each one of those cells have receptors for testosterone, progesterone, and estrogen. Also, our bone, our skin, and the muscles that allow us to blink, just like we talk about milking a cow, you're blinking, trying to milk the oil out of your glands, all have receptors for testosterone, progesterone, and estrogen. So if you're on birth control, or you're having a baby, or you're post-pregnancy, or you're premenopause, menopause, or postmenopause, those hormones are crucial in having these cells work properly. So if you're having dry eye disease and you've tried all the FDA-approved drops and treatments and you're still not getting better, you got to ask yourself, did you use birth control in the past? That's a factor. Are you on birth control now? Are you pregnant? Are you post-pregnancy? If you're a man, how old are you? What is your testosterone level? These all have factors. And as you enter in the menopausal stage, or you're about to enter like the perimenopausal stage, which can be around the age of 40 for some women, you should be asking your OBGYN if you should be on what's called bioidentical hormones. So let's talk about testosterone first. We'll talk about bioidentical hormones second, and then we'll do a different podcast on all the papers with all the controversies behind it. So the first thing you want to do is talk to your ophthalmologist. Is there anything besides those types of hormonal changes that could be causing the dry eye disease that we want to take care of? Obviously, patients that are on Accutane, we take them off right away. So medications are a crucial component. But if you're starting to have kind of the aging effect of your skin and your bones and you're tired, or if you're a woman, you're starting to have dryness in other parts of the body. We know that everyone gets dry with aging. So you want to find out, well, should I get number one, should I get a hormone panel? That's the easiest way to find out whether you should take these medications or not. That's simple. You can go to your PCP or your GYN to get a kind of estrogen, testosterone, progesterone level, and that doctor will tell you, is it a good idea or not for you? In general, it is a good idea. Testosterone seems to be very, very safe for the majority of women and men, and we'll go through the dosing in just a few minutes. But basically, you still want to probably get that tested, especially if you have a condition like PCOS, where the testosterone level, for instance, in women can be a little bit altered. Obviously, if you're pregnant or planning to get pregnant, you do not want to take any of these hormones. So you want to definitely check with your doctor first. And I would recommend a general exam and a hormone level. And the hormone levels are generally checked every 6 to 12 months if you're starting any of these hormones. So having a good relationship with a doctor or GYN is crucial. The second is the doctor and yourself are going to talk about your risks. Did you have birth control when you were young as a woman? Because that can increase your risk of potential cancer in the future if you take one of these hormones. Otherwise, you want to also find out, when did you start your menses? How many pregnancies you've had? Do you have breast cancer in your family? Do you have a BRCA positive gene? If you have those positive factors, or if you're a smoker, your doctor may not want you to start bioidentical hormones or hormone replacement therapy. The biggest issue for women is that the Women's Health Initiative study that in 2007 indicated there was an increased risk of cancer with hormone replacement therapy had major issues with the study, indicating it really wasn't as significant as they thought. And so a generation of women did not have the benefit of hormone replacement therapy. And now women are aware that bioidentical hormones are definitely safer and better. However, there are still patients that have an increased risk of having progesterone and estrogen together, and it's not without risk. So yes, I do recommend it for my patients that are low risk or maybe entering the kind of perimenopausal, menopausal time, but it really depends on those other factors. That as an eye surgeon, obviously we talk about the dryness, so in general the answer is yes, it's helpful for most women, but every patient is different. So talking to your GYN about it is crucial. That having said, if I were about to obviously get into that time of the menopausal time, I would probably start the estradiol and progesterone as a bioidentical hormone, which means it is usually derived from soy or jam, like plant-based, and the risks are very low. It can be titrated up, but I would probably check by levels every 6 to 12 months as well to just make sure that it's the right amount of hormone for myself, and then see how it helps if symptoms and so forth are affected. For testosterone, if I had dry eye disease that was terrible and nothing was helping, I would definitely try testosterone, assuming there's no other risks in my family. Testosterone is super safe in most of our patients. You do not grow extra hair. The cream can be used as a drop or a cream. Most people use a cream. It can be put anywhere on your body. It doesn't have to be put on your face. I haven't seen anyone have extra facial hair. I haven't seen it even reported, but testosterone is something that's very safe. The way we use it generally is 3 to 5% cream twice a day. It is not FDA approved, it's off label, so you need to find a doctor that feels comfortable prescribing that. As drops, it's 0.05 suspension 4 times a day, and we usually prescribe a 15 milliliter bottle. We use O'Brien's compounding pharmacy that works to send the patient's testosterone to their house. So in general, the answer for most patients is I think it's safe, and I do think it does help with dry eye disease in certain patients. There have been some papers that say it doesn't help with dry eye disease, and if you're using estrogen, I should say alone. So if you're using estrogen alone, some papers say it makes dry eye disease worse. So it really depends. And we have a whole series of women that are using birth control that feel worse in their dry eyes when they're on a birth control pill. So everyone is a little different, but we'll go through all the controversy in the studies in the next episode. But the punchline is basically talk to your GYN or your PCP, get your hormone levels checked, Think about your risk factors. Do you have any genes in your family that could make you more likely to have a breast cancer if you're a woman, if you're going to start the estrogen and progesterone? In men, if you have testicular cancer, your doctor probably is not going to put you on testosterone, but it depends. So just think about those types of factors. And then the last is you assess the symptoms. If you do end up starting testosterone or progesterone or estrogen, you see if it is helping your dry eyes or the other symptoms you might have. So anything you can do to basically keep those levels kind of as stable and trying to kind of see if it's going to help your symptoms and decrease, not increase your risk of any issues are something you should talk to your medical doctor. In the meantime, do those basic things that we've talked about in previous podcasts. Blink. If you're looking at me, don't waste your eyes. I'm no longer eye worthy if you know what I look like, so close your eyes. If you can do warm compresses, massaging, blinking, those things do help the stem cells of those glands, help the oil come out better. They help decrease inflammation, which makes all cells not work as well. So anything you can do in your lifestyle to decrease inflammation is what you want to do. And for some people, it is testosterone, estrogen, and progesterone, and for some people, it's not. So it can depend on your different risk factors. So I hope you found this podcast helpful. In the next podcast, we're going to go through some of the papers that talk about the positives and negatives of these different options. Thank you for tuning in.